Buoy Health Insights, left shoulder numbness. Hello and welcome back to Buoy Health Insights. In today's video, we're diving into the topic of left shoulder numbness. Have you ever felt your leg go numb after sitting too long? That odd sensation of pins and needles can occur in your left shoulder too, signaling everything from benign to severe conditions. Whether you're experiencing this symptom yourself or want to learn more, this video will help you understand what might be causing that numbness, other related symptoms, and when it's time to seek medical care. So let's dive in and explore the potential causes, symptoms, and when to reach out to a healthcare professional for left shoulder numbness. Let's start with what numbness actually is. It's when you lose feeling in a part of your body. When it happens in the left shoulder, it could be related to a complex network of nerves that control the upper limbs, the brachial plexus. These nerves originate in the spinal cord in the neck, travel down and across the first rib, and extend into the armpit to provide feeling to the arm, hand, chest, and shoulder. The axillary nerve, which is a branch of the brachial plexus, is primarily responsible for the sensation in the shoulder. There's also the supraclavicular nerves that contribute to this area, although they aren't part of the brachial plexus. So, why might you feel numbness in your left shoulder? Causes can range from traumatic to systemic and fall largely into two categories. First are the traumatic causes. Direct injury, such as dislocations, fractures, or sprains that could harm the nerves. Compressive injury, like when anatomical structures, such as your first rib or clavicle, press on the nerves, leading to something called thoracic outlet syndrome. Or even entrapment, where a nerve, like the axillary nerve, gets trapped in a confined space near the shoulder. And then there are systemic diseases. Metabolic issues, such as diabetes, can cause peripheral neuropathy, resulting in numbness. Tumors, although rare, can also grow and compress nerves in the upper arm. Aside from numbness, you might notice other symptoms like burning or tingling sensations, a feeling of pins and needles, sensitivity to touch, pain in the shoulder, weakness, making it hard to move your arm in different directions or hold on to things. These symptoms can be frustrating and, in some cases, quite concerning. Each potential diagnosis has its own set of symptoms too, so if your numbness is related to a specific condition like rotator cuff tendonitis or repetitive strain injury, you'd likely experience pain that worsens with certain arm movements or after repetitive use. But when should this numbness prompt you to seek medical attention? Well, if numbness comes with weakness or a lack of pulse in your arm, it could be vascular thoracic outlet syndrome, which can lead to permanent damage if not addressed promptly. Injuries that can lead to rotator cuff tendonitis and overuse, indicating a repetitive strain injury, should also not be ignored. In summary, if you are experiencing numbness in your left shoulder, along with any of these symptoms, or you have concerns about your condition, please see your primary care doctor. It might turn out to be a low-urgency situation, but it's always better to be safe and get proper care. We hope this insight into left shoulder numbness has been helpful. If you enjoyed it, give us a thumbs up and don't forget to subscribe for more health insights. Thanks for watching and stay healthy.